Hello students, I am Dr. Praveen Tripathi and with me is Dr. Raina Chawla, faculty of OBG, and ma'am is an excellent clinician and also an amazing teacher. Ma'am, I have watched many videos of yours and I love the way you present the content. The content is so clinical, so conceptual, and it's just fun to watch. But even more than the main videos that you put out there, those small snippets, those 60-second clips that you put out there, they are very interesting. They are always some kind of case, and you have done some kind of intervention, and then you talk about it, and then you talk about some kind of MCQ. So they're very fun to watch, and of course they're very knowledgeable. So ma'am, what is the idea behind putting these short videos out?
So short videos, because YouTube and Insta allow me only 1 to 1.5 minutes. That's the reason. But that is also good because the attention span is so limited. I want to put out maximum clinical material out there, which will help the student with understanding the basic concept. Because rather than reading, mugging up, if you see something like a procedure, you will never forget it. For example, if you read about an episiotomy versus actually seeing the procedure, and if I ask you tomorrow the same question, you will remember if you've actually seen the procedure. So that is how I built this concept on my Instagram and YouTube channel, is by putting out things which I actually do in day-to-day life, and that's what's important for the student.
So ma'am, when a patient walks in your clinic, so do you get that thought that what all MCQs can be asked?
So I do get the thought. More than that, in my OT, I always get this thought, which part of the surgery can I fit into my teaching? And I always take consent from the patient that I might use this. And it does help because a lot of clinical questions which come are now based, a lot of questions come are based on actual day-to-day scenarios which we see and which may not necessarily be given in the book or the notes. So this is one thing which I try to make the student understand, that this is what needs to be understood and this is the best way to do it.
So it's a very new and refreshing way of teaching, where you talk about a patient, talk about a case, talk about a procedure, and then talk about the relevant MCQs. So if you want to see all these high-yield information, all these amazing videos, you can follow ma'am's channel, which is OBG by Dr. Raina.
OBG classes by Dr.
OBG classes by Dr. Raina. And please keep doing the same. It's so wonderful.
Definitely. Thank you so much.